And next we have District Attorney's Office.
Good morning. So let's see, there's my slides. I think I'm the only one that did color. I spent a lot of time on that. So accomplishments, of course, successfully prosecuted several high-profile murder cases that resulted in significant prison commitments. And that includes not only a trial that lasted several weeks, but also settlements that resulted in a very, very significant terms, but also in every case that we settle, especially in murder cases or attempted murder cases or any crimes of violence, we reach out to the victims and make sure that they understand why we're doing what we're doing and that they are okay with what we're doing. Sometimes they're not really happy, but they understand why we have to settle certain cases, whether it's, lack of being able to prove beyond a reasonable doubt certain cases because of evidentiary issues. But the good news is that our caseload for pending murder cases has been drastically reduced. And I hope not to have new ones, but that's beyond my control. So we have a mental health court now, and this is new with the courts, started last year, I believe. And our focus is, obviously, we attend those, that court hearing. We advocate for the protection of the victim's rights and to make sure that if there is going to be an individual is going to go into mental health court, that the victims is protected with a protective order, that that the cases are monitored so that if there is a violation, it's brought back right away as soon as possible. We're still working on that because there's still some procedures that the court is working through. We are there to serve the victims, though, and our priority is community safety. We are, obviously, our victim witness office is part of the DA's office, and we provided victim services in 2022 to 1,443 victims and family members. And that is an increase of, in 2022, that's an increase of pre-pandemic numbers of 892 in 2019. So it's significant increase. And our staff did a phenomenal job of assisting these individuals from going to court with them, victims, going to court through arraignments, from arraignments to motion hearings to sentencing, where the victim has a support person there for them. And they can call victim witness and ask questions about the process of the case. And so the victim witness advocates are so important. We also conducted 58 forensic interviews of children at our Hope Center, and these are so important because it's a safe space for these children to talk about what is the worst thing that has ever happened to them. And we have a phenomenal forensic interviewer whose experience has been doing a lot of these and does a great job. So I'm happy that we were able to do that. We also included in that number, we've done a couple of interviews for agencies outside of Lake County, cases outside of Lake County, and then they have, other counties have done some forensic interviews of victims who have moved to another county. So in 2023, this is an ongoing theme with every department, but we continue to recruit full-time to fill positions and provide training and experience to develop happy and satisfied employees. And I think that we have been able, in 2022, hired 2 deputy DAs and other personnel. We emphasize the experience that an individual will get when they come to Lake County in the DA's office, especially deputy DAs. They're going to be in court right away. We emphasize the fact that if you're in a bigger department, you're probably going to be doing motions and not get to court very often. We emphasize that. We have a new deputy starting in mid-February, so I'm excited about that. But we need to continue to recruit, and I am going to try to set up a partnership program with some local, not local, but some of the surrounding law schools to try to increase recruitment for Lake County. We continue to work and will work with law enforcement, with the new sheriff, the new chief of Clear Lake Police Department, and of course, Lakeport Police Department chief and CHP and Fish and Wildlife. So we have a good relationship with all those departments. We are going to look into upgrading our case management system in order to keep better statistics that are going to be required by the state in 5 or 6 years, but we need to work towards that. I also want to upgrade our management system so we're more easily can file things with the courts. They switched over to a new court system, so we want to try to be more compatible with them. And so that's going to be an ongoing thing, not just in 2023, but 2024 and 2025 to get the right system in place. And we will continue to work with mental health court, and maybe I would suggest to the courts meetings, monthly or quarterly meetings, so we can get those procedures down faster. If somebody's going to go into mental health court, that's done quicker than later, so that there's not a big delay in terms of those individuals getting into court, especially when you're dealing with mental health. They need services right away. They need to be under the court's direction quicker. And also for the victims, they need to know that that's going on so they're not left hanging in terms of what's going on with that case. So that is my presentation, and I will take some questions.
Supervisor Crandall?
Yes, I wanted to emphasize one of the bullets that say work with law enforcement to make our neighborhoods cleaner and safer. And I know you've been to some meetings with me with some neighborhood watches and in dealing with meth, of course. And I know a lot of state laws that are intact that, hinder or handcuff both you and the sheriff's department. But just wanted to, highlight that a lot of the drug houses are connected. Meth is the root contributor to dumping cars, RV, catalytic converters, occupying homes illegally, public nuisance, theft, code violations, and an overwhelming burden to your department and law enforcement, which, once they're let out, it's recidivism. So I really want to work to assist any way we can in any type of legislation on our end that can help give you anything. I know I've talked with code enforcement on different angles to try and, I think one of the things is when anyone's dealing with nuisances as such, making them uncomfortable as well. I know that a lot of it stems from mental health, so I just highlight it because I know it's a lofty situation, but I want to do what I can to help because it's really it's really a big deal, and I know in my district and others, but I found different areas. That's why I got the flock cameras, where they're connected in different towns. They go to different areas. So just letting you know, I really want to work with you and the sheriff's department and getting some of this at least in a position where we can start from or something like that. So I don't know what you have in mind yet, but I think maybe we should set something up to try. And I know the task force is something that's intact, but,
Right.
So just wanted to highlight that.
Thank you. And definitely, I agree, we could, definitely should meet. And I am a member of the task force, and I'm looking forward in this new year to continue with that, as well as, obviously, the whole of Lake County needs to have changes, and so that we can abate places that are, clean up places, so we can get people to come and visit Lake County. It's as a safe place, a beautiful place. It is a beautiful place here.
Right.
So.
And I think, too, it's just the meth situation, they get let right out, and so if there's something else we can work on to charge some of these folks with, of course, we have to have the burden of proof. A lot of communities are willing to work to provide that, of course, if it's unbiased. But, I just think that those are the angles that need to be used in order to, slow it down, if that makes sense, because then keeping them in a position where they have to get sober and, look at other things.
There's a lot of issues involved there, including the changes in the law in regards to individuals. A lot more individuals are being released once they're picked up, maybe even on warrants, even if they've failed to appear previous times. A lot of them because of the changes in the law and case law in regards to keeping people in custody on bail, especially for just possession of drug cases. That's one big issue that maybe we can work together to try to figure out how to deal with that, because it is very frustrating when you have individuals who commit not only possession of drugs for sale, but also the other associated petty crimes such as theft, vandalism, other things that we try to keep individuals in custody on those, but we can't. And then they commit new offenses once they're out. So even before they have gotten to court on their first case, they already have committed a new case. So,
Right. And that's where it's at, yeah.
Yeah.
I just know that a lot of community members are in a position where they know that our DA's office and law enforcement is their hands are tied. So they're like, well, we only have ourselves to deal with it now. And so it's like getting close to that. And I just see what we can do in order to prevent that. So,
Right.
yeah. Thank you.
Okay.
Supervisor Green?
Yeah, thank you. I appreciate this report and the highlighting the mental health court, but there's other specialty courts too. There's a drug diversion court, there's veterans court. And so a question doesn't need to be answered now, but the way state law tracks now in these various specialty courts, challenges implementing a mental health court. We have care court coming down the road in a year or two. So one, very creative, and I'm glad to see the state take these adaptive measures for dealing with some of these difficult issues. Two, I don't know how much additional workload and how the changing standards of these various specialty courts create for the DA's office and our not public defenders, but our contract defenders. It's a lot. And so you mentioned like there may be quarterly meetings with the courts and stuff like that, but I'm looking for opportunities here, whether from the DA or through some meetings with the courts, to give us kind of a report card of where we're at. Because again, just tracking back the dependency works as best as it might, given the circumstances, but still room for improvement in my very amateur post, having worked with that. Similarly, we may have room for growth in these specialty courts, but without us tracking up there and observing things in very case-specific ways, it's hard for us to get a feel for how well things are working. But I suspect they might be similar to juvenile dependency cases. There may not be enough days, there may not be enough attorneys. Definitely, there's not enough judges to keep things rolling smoothly at all times. So whether it's through your office directly or if it's through some partnership with the Superior Court, I'd love to hear more about it and more often about how these various specialty courts are working and what challenges you may be facing in that. So thank you.
Great, okay.
And I just have one more question. Each year we talk about illegal cannabis, environmental crimes, and I was just wondering what your plans are for this year, if there's going to be anything different, if anything that you can share with us.
Well, we continue to prosecute illegal cannabis grows, and law enforcement goes in, eradicates, and brings us the case. We continue to file those. Those are mostly misdemeanors unless we have sufficient environmental crimes that we can prove to charge a felony. But we are continuing to prosecute those cases because it's important. If you have an individual who has two possession for sale of marijuana or two cultivation cases, convictions, then the third time can be a felony. So it's important to continue to prosecute those. Obviously, it's not only, even if we can't charge environmental crimes, it is an environmental issue with those illegal grows. So we will continue to pursue those, and we do have several cases that involve environmental crimes that are still pending. Sometimes those take a long time to make its way through the court, especially if it's going to go to trial, it's competing with other violent crimes. But we do continue to prosecute those.
Thank you.
Okay.
I think we're done. Thank you.
Thank you.
All right. And health services is next. Of course. And thank you for coming in during your leave time.
My honor. Good morning, board. Good morning, community and partners. Peers. So, the health department is going through an organizational transition. As we are aware, there was a thing called COVID-19 that disrupted health departments globally, but especially here in Lake County. And we're not out of the woods yet. COVID-19 is still here, prevalent. And our goal is to look into the future, right? What does it look like to shift, but still maintain? And so in this presentation, I'll outline some of our accomplishments and where we look forward to going to into the upcoming years. But first, we're halfway through the agenda for today, so I figured I'd throw out a cool glow. I have been on leave taking care of my newborn son, and I got a call from Mary, who was a labor and delivery nurse who was responsible for delivering my mother here in Lakeport. And she called to say congratulations for my son who was delivered here in Lakeport. So I'm seeing a generational trend here. So we'll see what happens with my son. But I always appreciate calls like that from the community. So without further ado, I would like to highlight some roles that we filled in 2022. Like most departments, filling positions has been quite difficult, but I think it's the resiliency and grit of the staff at the health department to fill positions that we've been able to accomplish this list. So we've been able to hire an interim health officer, Dr. Carl Spohr. We just hired a director of nursing, promoted a deputy of health service, and promoted a deputy of public health. Hired an epidemiologist, a health equity coordinator, promoted a health service manager, and hired a health services administrative manager. Pretty proud of that list for my staff and my team. Meaningful partnerships and development. Recently, Jail Medical Services, WellPath, we were able to accomplish a $3.9 million contract to provide jail medical services. Now, this isn't done in isolation. This is done in collaboration with the Sheriff's Office, Social Services, and Behavioral Health. It hints on Mr. Metcalf's CalAIM initiative. We're looking at whole person RAP care to look at recidivism. How do we reduce that while still providing health so that when someone gets discharged, they're able to get full scope services to provide them the resources they need to be and continue to be a resilient and contributing member to our society. A license agreement with the city of Lakeport, something that many of us and many of you have experienced are hazardous events, fires, floods, quakes. We're always looking at how we meet and support all partnering agencies and people, especially those who are ADA. So this emergency medical respite center that we are looking to develop is going to provide a space for people who need potentially charging stations, places to go for electricity, the opportunity to have a space, a dedicated space, where they can come get those much needed services. So if they have, for example, electric wheelchair, they can come charge it there if their electricity is down at their house. Same with breathing apparatuses, ventilators, etc. It'll do a couple things. It will hopefully provide a safety net, but also provide a place for our first responders and our hospitals to be able to send people if they, God forbid, become at capacity and don't have the necessary resources to be able to provide that care. Something that I'm looking at is eCornell online courses for residents and staff. And virtual learning seems to be a new trend, not only at universities, city colleges, but even for our staff. And providing an opportunity for public health education or CEUs, credits for whether it be community or staff to get public health knowledge, administrative knowledge, tech knowledge, what have you. Really leveraging eCornell to be able to provide those services. UC Davis and our DEI programming, annual programming for our staff, diversity, equity, inclusion, that's important, and I'll hit on it on the next slide. An expansion of our California Children's Services, also known as CCS, Diagnostic and Treatment Services, which I'll also elaborate how we're going to just really quick one, you don't have to go back, but about meaningful partnerships. I just want to give appreciation to Hope Rising, Executive Director Justin Gaddy, for our CHIP and CHNA initiative that we're working on, Behavioral Health Social Services for their commitment and collaboration to wrap services in CalAIM, and our Fire Department, Sheriff's Office, and Police Department for public safety and their collaboration to put an emphasis on health safety. So, now moving into further accomplishments. I referenced in the beginning organizational restructuring. What does that mean? It's very broad. But something that we're looking at is how do we give back time, right? How do we advance systems so that our staff can focus on what we're here for, which is community health, right? Treating the people. And so implementing a new electronic health record system, the team has been amazing at finding and executing an RFP and finding valuable solutions to improve efficiency and financial integrity. So it's timely, cost-effective, and gives back time to our staff so they can engage with community. Looking at that with our environmental health and our overall program. Another accomplishment would be our MOAC, our Medical Health Operations Area Coordination Manual. Several pages, the board has it, it's pretty dense, but it's how do we work together with our fire department, sheriff, social services, behavioral health to address mutual aid, so that we're not working in isolation, but we're working in collaboration. Again, that looks at cost effectiveness, time management, again, to ensure that we are communicating effectively so that the most important people, our residents, receive the care that they need. One of the choke points that we as a team established is if we're going to continue to have our department and county be as desirable as possible, which it is, we need to make sure that our onboarding processes and procedures for our health department and our staff are seamless. So when people come into our department and into our county, they know where to go, where the great places are to eat, where the great hikes are, how to log in, log out, and navigate the system so that when there is an issue or need for a staff member, they have direct sources on where to go to get that, and they don't have to spend a lot of time in ambiguity trying to figure that out. So our team has put together very detailed onboarding policy procedure that's going through several levels of accreditation so that when a new staff member comes on board, they have all the resources and tools that they need to navigate our health system. And just to highlight the general accomplishments around health, COVID-19, monkeypox, RSV, and influenza response for our team in partnership with county CBOs and stakeholders has been top tier, and I'm really proud of the team and the community for stepping up to address that. So, looking at 2023 and beyond, this isn't just a goal that we're looking at for this year. We're looking at this to be a staple for our department. Some of you may and some of you may not know that the APHA, American Public Health Association, and AMA, the American Medical Association, they consider racism as a public health emergency. And so understanding that and the importance of just the fundamental basic care that we need to look past external and look internal. Anyone who has a heart needs to be served. We're really trying to ensure that we place focus on diversity, equity, inclusion, and belonging. And when I say internally and externally, a standard for our staff and our service of care. And that's acknowledging that cultural competencies and health disparities as they relate to health outcomes and how they relate to the workplace. This is really important to me, and I believe it's important to the board and the community that we put diversity, equity, inclusion as our foundation on which we build, because all staff and all community, they should be able to come to a place, especially for health, that they feel seen, heard, and valued. So continuing to improve our onboarding processes and procedures and provide peer and professional relationship building for our staff will be a top priority. And I'm confident actually, that this will increase staff cohesion and amplify our shared purpose and vision and mission. And partner and build with on community-based harm reduction coalition. Mr. Metcalf referenced a mobile van that goes out to provide service of care, and we have and are in discussions around how we can coordinate with our health department to provide a spoke of care in that to address morbidity and mortality, and leverage CalAIM to address health disparities, improve service delivery for whole person care, and really focusing on partnerships and community-based organizations.
Okay, questions or comments? All right, I think that's it. Thank you
Great,
so much.
thank you.